One thing that I noticed just, moving further into adulthood is how many women suffer miscarriages and people don't talk about it. How common is it just looking at the data?
1 in 4 women will experience a miscarriage in their lifetime. And it is common because there are a lot of typos or errors that can happen along the way. Oftentimes, a large majority of these are because of something called chromosomal errors or imbalances. And these are even more common as we get older. It is something that often happens in the first trimester. And I think a lot of people don't share that they're pregnant. So a lot of women will suffer in silence. And this is something that has had a lot of stigma and guilt and shame surrounding it.
I'm so glad we are talking about it. I suffered 2 miscarriages before I had my first healthy baby. And I think when you start talking about it, you realize you're not alone. Other women have experienced this, and it's very common. Dr. Domar, talk about sort of that emotional roller coaster that a couple goes through when something like this happens. You go from such happy news to such devastating news.
Well, the fact is, as soon as someone finds out they're pregnant, the fantasies start. What, we're going to talk about names. What is the nursery going to look like? How are we going to tell people? Are we going to have a gender reveal? And that really starts early on. And for a lot of women, it doesn't even, they don't even think they could lose the pregnancy. I've had so many patients have a loss who thought, especially after infertility treatment, that they couldn't have a loss. 5 years after a loss, most women still think about that loss regularly. 5 years, even if they've had several healthy children, like someone like you who had a couple losses and then had a healthy baby, you're clearly still thinking about your losses.
You never forget it. That's true.
No, you never forget it.
It's interesting. We are 4 women talking about this, but, not to center men, but I do think a lot of times men or our partners generally, they experience these losses as well. And there actually isn't an infrastructure for them to feel comfortable talking about it. What tips would you give for partners who are also watching their pregnant partners lose?
Well, when and I do a lot of couples counseling, especially after a loss. And what the partner will say is, I spent the first 3 months taking care of her. She was a mess. She was crying all the time. She wouldn't leave the house. She was just inconsolable. And so all my energy had to be taking care of my wife or partner. And then the wife gets better, and then it hits the partner. And so as the wife gets better, and in fact, usually about the time the wife wants to try again, then it's hitting the partner. And he's like, whoa, wait a minute, I am not ready. This was so awful. Because for the partner, it's not just they also lost a baby, but they also had the experience of having to deal with an absolutely devastated partner. And so it's a double whammy for the partners.
So I would imagine, Dr. Sikon, you would recommend both partners seek some sort of counseling or talk to someone about this so they can be in a good position to try to conceive the next time. But can you walk us through some of the physical concerns here and the kinds of things that you test people for to make sure they don't have this experience again?
Yes, I think when people have experienced this, often they ask, when can I start trying again? And many times they're surprised to find out that it really depends on the person, right? Physically, as soon as you're feeling back to your normal self, but I always recommend taking some time to rest. And, hydrating, gentle movement is fine. If exercise is something that helps you with your mental health, I think from a mental health standpoint, it can really vary from person to person, and there's no right or wrong answer. But if you have had 2 or more consecutive miscarriages, it is important to know that that is not as common. That typically affects 1 in 100 people, and it does require a very focused workup. There's a whole list of tests that we do, whether it be ultrasound imaging or blood work, to kind of give you a clean bill of health to say, hey, we haven't identified any recurrent issues that could put you at risk of future miscarriages.
And that's 2 or more in a row.
Correct.
Okay. Dr. Lucky Sikon and Dr. Alice Domar, thank you both so much for being here and helping us lift the veil on this really common, topic and
conversation.
Experience. Yeah.
We need to talk about it more.